If you care about your health, your confidence, and the quality of your life as you grow older, I want you to stay with me today, because some of the smallest changes in your sexual health can sometimes tell you something much bigger about your overall well-being. And I know that may sound serious, but let me ask you something very simple. Have you ever noticed a change in your body, told yourself it was probably nothing, and then simply carried on with your day? Many men do exactly that, especially when the change involves their erections, sexual sensitivity, or intimacy. But these changes should not automatically be dismissed. Your body often gives you signals before a problem becomes obvious, and learning to recognize those signals can help you take action earlier, rather than waiting until the issue begins affecting your confidence, relationships, or quality of life. Today, we're going to discuss 10 things you should never do to your penis, including everyday habits, mistakes, and overlooked behaviors that can gradually interfere with sexual health. By the end of this video, you'll have a much clearer understanding of what to avoid, what changes deserve your attention, and how simple, healthy choices can help support erectile function at any age. And before we continue, tell me where you're watching from. Leave your country or city in the comments below. I always enjoy seeing men from different parts of the world taking an interest in their health and learning from one another. And if you find this information useful, consider subscribing, because when it comes to men's health, you deserve practical information based on evidence rather than myths, embarrassment, or internet shortcuts. Here is something every man should understand. Your penis is not an isolated part of your body that exists separately from the rest of your health. Erectile function depends on several systems working together, including healthy blood vessels, proper nerve function, hormones, and psychological well-being. When one of those systems begins to struggle, sexual changes can sometimes be among the first things you notice. That is why erectile difficulties should not always be viewed as nothing more than a bedroom problem. In some men, erectile dysfunction can be associated with cardiovascular and metabolic conditions, because the same blood vessels and biological systems involved in erections are also involved throughout the body. Research has found an association between erectile dysfunction and an increased risk of cardiovascular disease, which means persistent changes deserve appropriate medical attention rather than embarrassment or silence. Think of it as information your body is giving you. You don't need to panic every time something changes, but you should pay attention, especially when the change continues or becomes more noticeable over time. I've worked with men at very different stages of life, and one thing becomes clear again and again. Younger men can become concerned when sensitivity or erectile function changes unexpectedly, while older men may worry that intimacy and sexual confidence are simply things they have to give up with age. But getting older does not automatically mean giving up your interest in intimacy, affection, or sexual well-being. One of the most important differences between men who address these concerns and those who continue struggling in silence is often knowledge. Understanding what your body is telling you, knowing which symptoms should be evaluated, and learning which habits may be working against your health can make a meaningful difference. So let's go through these 10 important mistakes one by one, because protecting your sexual health is not simply about performance. It is also about protecting your confidence, your relationships, your comfort, and your overall quality of life. The first mistake is one I want you to take especially seriously. Don't ignore changes in your penis. If your erections are becoming consistently weaker, if spontaneous or morning erections become noticeably less frequent, or if sexual arousal begins to feel different from what you've experienced before, don't simply assume that it is an unavoidable part of getting older. These changes can have many possible causes, including cardiovascular risk factors, medication effects, hormonal changes, nerve problems, stress, anxiety, or other medical conditions. And that is exactly why paying attention matters. When men ignore these changes for months or even years, the problem can begin affecting more than their physical health. They may start avoiding intimacy, making excuses, worrying about performance, or quietly questioning themselves. That emotional burden can then increase anxiety, which may make sexual difficulties even harder to manage. The practical approach is much simpler. Notice the change, give it some attention, and if it persists, discuss it with a qualified healthcare professional. You don't need to feel ashamed, and you certainly don't need to diagnose yourself from something you read online. Early evaluation can help identify an underlying cause and give you more options for addressing it before the problem becomes a much larger source of frustration. The second mistake is falling for dangerous home remedies or unproven internet solutions. I wish this were not necessary to say, but men can become vulnerable to questionable advice when they are worried about their sexual performance. I've seen claims involving household substances, improvised devices, excessive pressure, and other so-called shortcuts that promise stronger erections or better performance. The problem is that your penis contains delicate blood vessels, nerves, and tissues, and experimenting with unsafe methods can cause irritation, burns, bruising, nerve injury, scarring, or other complications. Often, these methods are driven by insecurity rather than a genuine medical need. A man may believe that something is wrong with him when the real problem is that he has been comparing himself to unrealistic expectations. If you're considering a pump, constriction device, medication, supplement, or any other product designed to change sexual function, choose something that is medically appropriate and, when necessary, discuss it with a healthcare professional first. Your sexual health is not an area where trial and error with dangerous internet hacks is worth the risk. Protect the body you have, understand what is actually happening, and choose evidence-based care instead of a desperate shortcut. The third mistake is neglecting basic hygiene. It may sound almost too simple to mention, but proper genital hygiene is an important part of men's health, and it becomes particularly important for men who are uncircumcised. If you have a foreskin, gently retract it during washing, clean the area underneath, and then dry it properly before returning the foreskin to its normal position. When natural oils, dead skin cells, sweat, and bacteria are allowed to accumulate, irritation and inflammation can develop. Conditions such as balanitis can cause redness, itching, swelling, discomfort, and sometimes difficulty retracting the foreskin. Good hygiene does not require aggressive scrubbing or harsh chemicals. In fact, excessive cleaning with strong soaps, fragrances, or irritating products can make the skin more sensitive and uncomfortable. Emotionally, genital irritation can also create embarrassment, making a man reluctant to talk about what is happening or even reluctant to become intimate with his partner. That is why I want you to think about hygiene in the same way you think about brushing your teeth. It is not something you should only worry about when a problem appears. A few minutes of gentle, consistent care can help prevent much bigger problems later. Use mild soap and water around the external area. Avoid harsh products, and pay attention to any persistent redness, swelling, discharge, odor, or discomfort that does not improve with normal care. If those symptoms continue, don't keep trying to solve the problem yourself. Get it checked. The fourth mistake is ignoring pain, bleeding, unusual lumps, or other changes that don't feel normal. Your penis should not routinely hurt, and pain should never simply be dismissed as an inevitable part of aging. Pain during sexual activity, pain or burning with urination, blood in the urine, a persistent lump, a sore that does not heal, unusual discharge, or a new change in the appearance of the penis can have several possible causes. Some may be relatively straightforward to treat, such as irritation or an infection, while others may require more urgent evaluation. In some situations, symptoms can be associated with conditions affecting the urinary tract, kidneys, prostate, or penile tissue, and rarely, persistent penile lesions can be related to cancer. The important point is not to assume the worst. The important point is to avoid assuming that everything is harmless. When a man ignores a concerning symptom because he feels embarrassed, he may spend weeks or months worrying privately while also delaying the care that could have provided an answer. That creates unnecessary stress and can make a treatable problem more difficult to manage. So if something changes and it persists, speak up. Seeking medical advice is not a sign of weakness, and asking questions about your own body is not something you should feel ashamed of. It is a responsible decision. Your doctor has heard these concerns before, and the sooner you know what is actually happening, the sooner you can decide what needs to be done. The fifth mistake is losing control during sexual activity and forgetting that safety matters, even in moments of strong passion. I want men to understand that penile fractures are real, even though the term can be frightening. A penile fracture is not a broken bone because the penis does not contain a bone in humans. Instead, it refers to a tear in the tough fibrous tissue surrounding the erectile bodies, usually when an erect penis is suddenly and forcefully bent. This can happen during vigorous sexual activity, particularly when the penis slips out and strikes against the pelvis or another firm surface. A sudden popping or cracking sound, immediate pain, rapid swelling, and bruising are classic warning signs. This is a medical emergency and should be evaluated promptly because significant injury can affect erectile function, urination, and the structure of the penis if treatment is delayed. The emotional impact can also be considerable. A man may become frightened about whether he will recover, whether intimacy will feel normal again, or whether the injury will change his confidence permanently. But the most useful response is not panic. It is getting appropriate medical care quickly. Prevention also matters. During sex, pay attention to positioning, communicate with your partner, and avoid unnecessary force or movements that place the erect penis at risk of sudden bending. Lubrication can also reduce friction and make sexual activity more comfortable. Intimacy is not a competition, and there is no prize for being reckless. Sexual connection should include pleasure, communication, and safety. The sixth mistake is repeatedly exposing your testicles to excessive heat when you're concerned about fertility or reproductive health. There is a biological reason the testicles are located outside the main body cavity. Sperm production works best at a temperature slightly below core body temperature. That does not mean that every hot shower or occasional sauna is going to damage your reproductive system, but repeated or prolonged heat exposure can temporarily affect sperm production and quality in some men. This is especially relevant for men who are actively trying to conceive. Frequent hot tubs, prolonged sauna sessions, or keeping heat-producing devices directly against the groin for long periods may increase scrotal temperature. The situation with laptops, phones, and testosterone is more complicated than many internet posts suggest, so I don't want you to become unnecessarily fearful of ordinary daily activities. The evidence does not support the idea that simply carrying a phone in your pocket automatically causes low testosterone or infertility. What matters is the broader pattern of heat exposure and your individual circumstances. If fertility is a concern, discuss it with a healthcare professional rather than relying on social media claims. And remember that reproductive health involves much more than temperature alone. Sperm quality can also be influenced by smoking, alcohol, obesity, certain medications, infections, illness, sleep, and other factors. Your goal should not be to live in fear of heat. Your goal should be to understand the factors that genuinely matter and make sensible choices that support your long-term health. The seventh mistake is being too aggressive with masturbation. This is a subject many men rarely discuss openly, but it is worth understanding without shame or judgment. Masturbation itself is generally considered a normal part of sexual behavior, but the way you stimulate yourself can sometimes affect how your body responds to other forms of sexual activity. If you consistently use extremely firm pressure, very rapid movements, or a highly specific technique that your body becomes accustomed to, you may find that other types of stimulation feel less intense by comparison. Some men describe this as becoming conditioned to a particular type of stimulation, although the phrase death grip syndrome is an informal internet term rather than a formal medical diagnosis. The important issue is not the label, it is understanding how habits can influence sexual response. If you notice that you can reach orgasm easily with a very specific technique, but struggle to become aroused or reach orgasm with a partner, it may be helpful to vary your routine. Slow things down, use adequate lubrication, reduce excessive pressure, and allow yourself to experience different rhythms and levels of stimulation. Your goal is not to punish yourself or completely stop sexual activity. Instead, think about teaching your body to respond to a wider range of sensations. Sexual function is influenced by both the body and the brain, and giving yourself more variety can sometimes help reduce dependence on one very intense pattern of stimulation. If difficulty reaching orgasm or maintaining an erection continues despite changing your habits, however, don't assume masturbation is the only cause. Medications, anxiety, hormonal changes, nerve problems, relationship factors, and other health conditions can all contribute, so persistent concerns deserve a proper evaluation. The eighth mistake is smoking while neglecting the rest of your cardiovascular health. If there is one lifestyle factor I want men to take seriously when it comes to erections, it is smoking. An erection depends on healthy blood vessels because sexual stimulation requires increased blood flow into the erectile tissues. Tobacco smoke damages the lining of blood vessels, promotes inflammation, and contributes to the narrowing and dysfunction of arteries over time. That can interfere with the circulation required for a firm erection, while also increasing the risk of serious conditions such as heart disease, stroke, and several types of cancer. The connection is important because the same vascular health that supports your heart also supports erectile function. And this is why I don't want you to think of erectile health as something separate from your lifestyle. If you smoke, quitting is one of the most meaningful steps you can take for your overall health, and your sexual health can benefit as part of that larger improvement. The same principle applies to physical activity, nutrition, alcohol consumption, sleep, and stress management. Regular exercise supports cardiovascular fitness and circulation. A balanced diet can help maintain a healthy weight and metabolic function. Limiting excessive alcohol can support sexual performance and overall well-being. Managing stress can also reduce one of the psychological factors that commonly interferes with arousal. You don't need to transform your entire life overnight. Start with the changes that are realistic for you and build from there. Your erections are not a separate reward system disconnected from your body. They are influenced by the condition of the body you are living in every day. The ninth mistake is constantly beating yourself up when sexual performance doesn't go exactly as planned. This may be one of the most overlooked problems in men's sexual health because many men assume that every erection should work perfectly, every time, regardless of age, stress, sleep, medication, relationship circumstances, or emotional state. That simply isn't realistic. Every man can have an off day. Sometimes you're tired, sometimes you're distracted, sometimes you're anxious, sometimes you have had too much alcohol, you're under pressure at work, or your mind is focused on something completely different. One disappointing sexual experience does not automatically mean that you have erectile dysfunction. In fact, worrying excessively about your ability to perform can create a cycle that makes the problem more likely to happen again. When you're anxious, your body releases stress hormones such as adrenaline and cortisol, which can interfere with the relaxed state needed for sexual arousal. Then you notice the change, become even more worried, and start monitoring every sensation instead of enjoying the moment. The next encounter begins with fear rather than connection, and the cycle continues. This is why self-compassion matters. Instead of telling yourself that you have failed or that you are no longer a capable man, step back and recognize what actually happened. One imperfect night does not define your sexual health, your masculinity, or your relationship. If performance anxiety is becoming frequent, talk openly with your partner and consider discussing it with a healthcare professional. Sometimes, simply removing the pressure to perform can make intimacy feel much more natural again. And now we come to the 10th mistake, which is the idea that you should simply stop using your sexual system because you're getting older. You may have heard the phrase, use it or lose it, And while that saying is far too simplistic to explain the biology of erectile function, there is a useful principle behind maintaining sexual health. Regular erections are associated with normal oxygenation and blood flow within erectile tissue, and prolonged periods without erections can occur alongside changes in erectile tissue, especially in men who already have conditions that affect blood flow or nerve function. But I want to be very clear here. You do not need to force yourself to have sex or masturbate simply because someone told you that you will otherwise lose your erections. Sexual activity should be comfortable, consensual, and appropriate for your health and circumstances. Intimacy can take many forms, including affection, touch, sexual activity with a partner, or masturbation. What matters is staying connected with your body rather than becoming afraid of sexuality altogether. If erectile function has declined significantly, don't assume the solution is simply to stimulate yourself more often. The right approach is to understand why the change happened in the first place. Conditions such as diabetes, cardiovascular disease, low testosterone in some men, medication side effects, nerve disorders, prostate treatments, and psychological factors can all influence erections. Treating the underlying issue may be far more important than simply trying to increase sexual activity. Your sexual health deserves the same thoughtful attention you would give any other part of your body. So, what should you actually do with everything we've discussed? The first step is to become more aware of your own body without becoming obsessed with every small change. Pay attention to patterns rather than isolated moments. If your erections are consistently changing, if morning erections become noticeably less frequent, if your sexual desire changes significantly, or if you develop pain, bleeding, a lump, discharge, or another persistent symptom, write down what you're noticing and discuss it with a healthcare professional. You don't need to walk into a doctor's office with a perfect explanation. Simply being able to say, "This has changed over the last few months," can be enough to begin an important conversation. Avoid dangerous home remedies and products that promise instant results, particularly anything that involves chemicals, excessive pressure, improvised devices, or unverified supplements. Your sexual health should be treated with the same level of care as your heart health, because the two are not completely separate. When you choose a treatment or device, make sure you understand what it is designed to do, how it should be used, and whether it is appropriate for you. Evidence matters, especially when the tissue you're trying to treat is sensitive and highly vascular. Next, make basic hygiene part of your normal routine. If you have a foreskin, gently clean underneath it and make sure the area is dry afterward. Avoid aggressive scrubbing and strongly scented products that can irritate sensitive skin. If you repeatedly develop redness, swelling, itching, pain, unusual discharge, or difficulty retracting the foreskin, don't simply keep washing more aggressively and hope it disappears. Those symptoms may require medical treatment, and getting the right diagnosis is much more useful than repeatedly treating the wrong problem. Also remember that hygiene is not only about cleanliness, it's about noticing changes. When you know what your normal skin looks and feels like, you're more likely to recognize when something genuinely different has appeared. That awareness can be especially valuable when it comes to a persistent sore, lump, discoloration, or lesion that does not heal. Most unusual changes will not turn out to be something serious, but the only reliable way to know is to have concerning symptoms evaluated, rather than allowing fear or embarrassment to keep you silent. When it comes to sexual activity, prioritize safety instead of trying to prove anything. Use enough lubrication to reduce unnecessary friction, communicate with your partner, and avoid movements that put the erect penis at risk of sudden bending. If a serious injury occurs, particularly if you hear a pop followed by immediate pain, swelling, or bruising, don't wait to see whether it improves on its own. Seek urgent medical care. The same principle applies to urinary symptoms, bleeding, or significant pain. Your body is not asking you to be fearless. It is asking you to pay attention. And if you're concerned about fertility, be sensible about prolonged heat exposure, but don't let exaggerated internet warnings create unnecessary anxiety. Occasional heat exposure does not mean you've permanently damaged your fertility. Reproductive health is influenced by many factors, and if you're trying to conceive without success, there are proper medical evaluations that can identify issues with sperm production, hormones, anatomy, or other causes. Getting accurate information is far more useful than worrying about every device in your environment. Then take an honest look at your lifestyle. If you smoke, consider making quitting a priority. If you rarely exercise, begin with manageable movement and gradually increase your activity. If your diet is heavily based on processed foods, look for simple ways to add more vegetables, fruits, whole grains, legumes, lean proteins, and other nutrient-dense foods. Keep alcohol within reasonable limits, work toward a healthy weight if appropriate for you, and protect your sleep. None of these recommendations is a magic treatment for erectile dysfunction, and I would never want you to believe that eating one particular food or performing one exercise can instantly fix a complex medical problem. But your blood vessels, nerves, hormones, and brain all respond to the environment you create through your daily habits. Improving those habits can support your overall health and may also support sexual function. If you already have diabetes, high blood pressure, high cholesterol, cardiovascular disease, or another chronic condition, managing it properly is even more important. Sometimes the most effective step for improving erections is not something you do in the bedroom at all. It is something you do every day to protect your cardiovascular and metabolic health. And please don't forget the psychological side of this conversation. Men are often taught to measure their worth through sexual performance, strength, confidence, and the ability to always be ready. That expectation can become a heavy burden. When something doesn't work perfectly, a man may immediately interpret it as evidence that he is losing his masculinity or becoming less desirable. But your worth cannot be reduced to the firmness of an erection or what happens during one sexual encounter. Sexual function changes throughout life, and there are many reasons for those changes: stress, anxiety, relationship tension, poor sleep, medications, medical conditions, and normal variations in arousal can all influence what happens in a particular moment. Treat yourself with the same patience you would offer someone you love. If anxiety is affecting your sexual life, talk about it rather than hiding it. A trusted partner can be an important source of support, and a healthcare professional can help determine whether there is an underlying medical issue or whether counseling, stress management, or another approach might help. Asking for support does not make you less of a man. In many cases, it is one of the strongest things you can do for yourself. There is also an important distinction between being sexually active and feeling pressured to perform. Staying connected to your sexuality does not mean you need to meet some imaginary schedule or prove your ability to have intercourse at every opportunity. Intimacy can involve affection, kissing, touching, communication, closeness, and many other forms of connection. If you have a partner, talk openly about what feels comfortable and enjoyable for both of you. If you are single, maintaining a healthy relationship with your own body can still be part of overall well-being. And if you have a medical condition that affects sexual function, don't assume you have to simply accept the situation without exploring your options. Modern urology has many approaches for evaluating and treating erectile problems, and the right treatment depends on the cause. The goal is not to chase an unrealistic version of youth. The goal is to help you remain healthy, comfortable, connected, and confident within the reality of your own life. Let me leave you with something important. Needing to change a few habits does not mean that your body is broken, and it certainly does not mean that your best years are automatically behind you. Your body is constantly responding to the way you treat it, and sometimes a change in sexual function is simply a reminder that something deserves your attention. Instead of seeing that as a reason for fear or embarrassment, see it as an opportunity to become more informed and more proactive. Pay attention to persistent changes, avoid dangerous shortcuts, maintain good hygiene, protect yourself during sexual activity, Take care of your cardiovascular health and give yourself enough patience to understand that sexual function is influenced by much more than one moment in the bedroom. Your erections are connected to your circulation, your nerves, your hormones, your emotional health, and your overall lifestyle. That means taking care of your sexual health is also another way of taking care of the rest of your body. So, if you remember only a few things from today's conversation, remember these. Don't ignore persistent changes. Don't experiment with dangerous home remedies or unverified products. Don't neglect basic hygiene. Don't dismiss pain, bleeding, lumps, or sores that don't heal. Don't treat sexual activity like a competition where more force or more intensity is always better. Be sensible about prolonged heat exposure if fertility is important to you. Avoid stimulation habits that consistently make partnered intimacy difficult. If you smoke, work toward quitting and support your heart and blood vessels through regular movement, balanced nutrition, healthy sleep, and appropriate management of medical conditions. Don't allow one difficult sexual experience to become a judgment about your entire identity. And finally, don't abandon intimacy simply because you're getting older. Sexuality can change with age, but connection, affection, pleasure, and confidence do not have an expiration date. I also want you to understand that there is no single definition of healthy sexual function that applies perfectly to every man. One man's normal may look very different from another man's normal. Your age, medications, health conditions, relationships, stress levels, sleep, and personal circumstances all matter. What matters most is noticing when something has changed for you and deciding whether that change deserves professional attention. If you have occasional difficulty getting or keeping an erection, don't immediately assume something is seriously wrong. But if the problem becomes persistent, happens repeatedly, or appears alongside other symptoms, make an appointment with a qualified healthcare professional. Erectile dysfunction is common, and in many cases it can be evaluated and treated. There is no benefit in suffering silently when there are legitimate medical options available. The sooner you understand the cause, the more informed your choices can be. And please remember that asking for help is not a failure. Men sometimes wait far too long because they are afraid that admitting a problem will somehow make them look weak. In reality, ignoring a health concern because of embarrassment can take far more courage away from you than having one honest conversation with a doctor. You don't have to know exactly what is wrong before you seek help. That's what medical evaluation is for. A doctor can review your symptoms, medications, lifestyle, medical history, and cardiovascular risk factors, and determine whether further testing or treatment is appropriate. Sometimes the explanation is straightforward. Sometimes it requires a little more investigation. Either way, having accurate information is better than living with uncertainty. Your confidence should also never depend entirely on your sexual performance. A healthy relationship with your body includes accepting that there will be good days and difficult days. There may be times when your desire is lower, your erection isn't as firm as usual, or intimacy doesn't happen exactly the way you expected. That doesn't erase your identity, your attractiveness, your strength, or your value. Intimacy is about connection, communication, trust, affection, and pleasure, not simply about achieving a particular physical result. When you remove some of that pressure, you may actually create more space for genuine closeness. Your partner doesn't need a perfect performance from you. They need honesty, communication, respect, and connection. So here's the challenge I want you to take with you today. Starting now, make a commitment to protect your sexual health in the same way you protect your heart, your brain, and your future. Pay attention to your body. Make healthier choices. Stop believing every frightening claim you see online. Don't use unsafe devices or substances simply because someone promises a quick result. And when something genuinely concerns you, speak to a qualified professional instead of suffering in silence. These small decisions may not feel dramatic in the moment, but over months and years, they can become part of a much healthier way of living. And if this conversation helped you understand your body a little better, consider subscribing to the channel and sharing this video with another man who may be quietly dealing with the same concerns. Men's health is often surrounded by embarrassment and silence, and sometimes one honest conversation is enough to encourage someone to finally seek the help they need. You never know when sharing useful information could make a real difference in someone's life. Remember, getting older does not mean giving up on vitality, intimacy, or confidence. Your body may change, but there is still so much you can do to support your health at every stage of life. Take care of yourself. Listen to what your body is telling you, and don't be afraid to ask for help when you need it. You deserve to feel informed, respected, healthy, and confident, not only in the bedroom, but in every part of your life.